Hello everyone. Today I'm going to discuss about the continuation of the traumatic brain injury. In the last class we discussed about what is the traumatic brain injury, what are the incidents and what are the risk factors and causative factors, what are the different types of mechanisms and also what are the different types of injuries. So we discuss. Here we are going to see so this craniotomy surgery is nothing but cut the bony opening in the skull. So why? Because of if any swelling, or if because of any bleeding inside the brain, or if you want to do any specialized investigation procedures, any like a surgery procedures, if you want to do this one, how to use the craniotomy. Craniotomy is nothing but it's a cut in the like a skull. It's an opening and also cutting the skull. So it's a section of the skull called the bone flap is removed, assess the brain underneath. So they're going to be like we have to check how much the severity inside the brain also we can check through the craniotomy. Or maybe any bleeding or any hemorrhage or hematoma or any tumor, also we are going to assess with the craniotomy. Also, craniotomy may be small or large depending on the problem. So if it is a mild hematoma or in case of any hemorrhage in particular one place, so depends upon the severity, the size will be different. So it may be performed to treat the brain tumors, hematomas, that is the blood clots, aneurysms, abnormal blood vessel dilatations, and also AVM, arteriovenous malformations, traumatic brain injuries, and any foreign objects, any bullets or any sharp objects, any iron metals stuck into the brain, or maybe any swelling of the brain or any infection. In those conditions, so this craniotomy is indicated. So if any, for example, this one is the now traumatic brain injury. If because of traumatic brain injury, according to last class, they may chance to get the hematoma or hemorrhage. The hematoma may be in the subacute, like a subdural hematoma, and also epidural hematoma may chance to get, or maybe intracerebral hemorrhage. So depends upon the site and also the treatment plan will be different. Coming to the next one is the bone flap is usually replaced at the end of the procedure with the tiny plates and screws. So they're going to opening the windows in the surgery. So here, if you see here, any place. So from here, if you open here, this is the parietal region, frontal, temporal, and suboccipital. So anyway, depends upon the involvement of the site. Is it the hematoma in the parietal region, or maybe is the hematoma in the occipital regions, or in the parietal or temporal region, where they're having the problems according to them, how to do the surgical procedures. So if you see here, the different type of the craniotomy is there. So we are going to discuss about the how we are going to do the procedures. So if you see here, if anybody having bleeding inside, so how to open the brain and also how to open the skull and also dura mater, also brain. So where they're having the hematoma or hemorrhage, or how to clear up and also how to like drain the hemorrhage, and also then only after that how to close properly. So this treatment procedure will continue and also according to the systemic manner. So how does hematomas and also are going to be hemorrhage is going to be treated. So this one is going to be, so this bone flap is replaced, the procedure called as the craniotomy is a craniectomy. So that means if they remove the bone, so in case of if the brain swelling, so if the bone replacement is not placed immediately after surgery, the bone flap is going to be stored in the abdominal cavity of the patient, or maybe sometimes they're going to store in the deep freezer less than minus 70 degrees centigrades. So that then after some 2 to 3 months, so they're going to replace this bone at the normal place in the head. So that is called as the cranioplasty. So we will discuss what is the craniotomy, what is the craniectomy, and also what is the cranioplasty. So because this after this surgical procedures, how the surgical procedure are going to be performed, we are going to learn here. So here this craniotomy in the varying size and complexity, the small dime shape, and also craniotomies are called Bur Hole techniques. Bur Hole techniques means only small size. They are going to put in the hole in the cranium, from their place is going to be operate, or if in case of the small like a bleeding or hematoma and hemorrhage or any tumor, or if you want to do any other things, so the like a investigation procedure purpose, they are going to do the like a keyhole Bur Hole techniques. And also keyhole examination, like a keyhole craniotomies are the quarter size or larger. So keyholes are a bit larger than the Bur holes. Bur hole means only small hole they are going to do, and also keyholes are going to do the like a quarter size or larger. And also so many types of the techniques are there. So in the craniotomy also is the stereotactic frames, and image guided computers are and also endoscopes may be used to precisely place the instrument through these small holes. So these small holes, especially keyholes and also Bur hole techniques, are mainly used along with the stereotactic frames and also any computer like a video image guided computer systems or any endoscopes are going to send into the brain, and also have to do the surgical procedure with these equipments, and these equipments are inserted through the Bur hole techniques and also keyhole techniques. And also Bur holes and keyholes are used for mainly minimally invasive procedures. So it's going to be for the mains, the small instruments are going to insert in through the Bur hole. So if you see here, so these instruments are going to insert it into the like a brain through the Bur holes. So these techniques are called Bur hole techniques. And also this one is going to be, these techniques are going to use to measure or to do some insertion of some equipments. So mainly for the purpose of the deep brain stimulations. So with this small Bur holes, so they're going to send the deep brain stimulator to check the brain function, how it's deep, who are having like a motor disorders. They're going to insert the deep brain stimulators, particularly for the Parkinson's patients. This is the one instrument how to send inside, keep the instrument inside the brain to give the signal, stimulate especially for basal ganglia regions where they're having the problem. So that is a deep brain stimulators. And also next another instrument is insert the intracranial pressure monitors. So if you want to measure the intracranial pressure, so how to insert these instrument through this Bur hole and also keyhole techniques. And also small biopsy, needle biopsy. So if you want to identify what type of the cancer or any other infections or anything, disease progressions, so take the needle biopsy. So how to insert with the needle. So how to take the small amount of the tissue from the brain. So for the analysis purpose, so that is for the tissue culture, for the tissue investigation purposes, that is a needle biopsy. Next one is the drain the blood clot. In case of the hematoma or aspirations, so this Bur hole, through the Bur holes, have to send the drain inside the brain. So that is the purpose. And also endoscopic. So this also some type of the small surgical procedures to remove the tumors. So this endoscopic surgeries also. So these are going to be insert through this keyhole and also Bur hole techniques. So that is some procedures they can do through the Bur hole techniques as well as in the keyhole techniques. So if you see the other types of the craniotomies, so these craniotomies were so many types of craniotomies there. Stereotactic craniotomy, endoscopic craniotomy, awake craniotomy, and also keyhole craniotomy, supraorbital eyebrow craniotomy, and also orbitozygomatic craniotomy, and peritocraniotomy, that is the frontotemporal. So that is depends upon the site of the opening of the skull is called, the name it indicates the craniotomy. For example, parietal craniotomy is parietal means is going to be in between the frontal and temporal region. So if this going to be is called as the parietal craniotomy. If, for example, if it is opening in the orbitozygomaticus, the orbitozygomaticus means is going to be is opening at the orbital region and as zygomatic region. So the craniotomy is called orbitozygomatic. So if in case of the supraorbital means eyebrow craniotomy. So if they above the supraorbital means, so this is going to be, if you see here, this is called the supraorbital craniotomy, where the location the name indicates. For example, if it is opening the supraorbital means above the orbital features. So this is the craniotomy. And also if you see the stereotactic craniotomy, so this stereotactic craniotomy is nothing but this opening of the cranium with the help of and also they're going to use the MRI and CT scan while using the craniotomy. So these procedures, the doctors are going to use the image test, create the three-dimensional images of the brains. So while doing the examination, while doing the treatment plan, they're going to see in where exactly having the problem through the CT scan and MRI scan. So this type of techniques are going to be called as the stereotactic craniotomy. While doing the surgical procedures, if they want to get the full information where exactly what is the extent of the tissue damage or maybe tumor with the help of the CT scan and MRI scan, so this type of craniotomy called as stereotactic craniotomies. And next about the endoscopic craniotomies. Endoscopic means just now we discussed the keyhole we are going to do. From the keyhole, the endoscope will send into the brains, inside the brain. So identify any other this tube is going to give the complete information and image inside the brain. So through this brain is going to remove the affected part in case of the tumors and also in case of the any other abnormalities. And also next one is the awake craniotomy. This awake craniotomy means here the patient is going to be awake during the surgical procedures. So during the surgical procedures, so they're going to talk with the patients. So then only they're going to stimulate the where they're having the problem, especially for the speech and language and motor response and some reflexes. They will stimulate inside the brain. So according to the doctor's question, the patient has to respond. So it depends upon if the patient is not responding, means they're going to look at where they're having the problem. So if the patient replies, so that means that part is going to be normal. So they are going to assess where exactly having the problem. So this helps them to avoid these areas while performing the surgeries. So if their movement or vision, speech or auditory, so they're going to identify what they're having the problem. So these are the mainly for they're going to check the different type of the surgical procedures in the craniotomy. And also keyhole craniotomy. These keyhole craniotomies are used to remove the brain tumors. They're going to put the keyhole any particular where the involved structures. So it is a minimally invasive surgeries is associated with less scarring and so shorter recovery time. So if they do they no need to open the full amount of the skull or half of the skull there, and no need to open. Only they're going to be the small hole to send the what are the instruments that what they're going to use to cut the affected structure through the small hole. So that type of surgical procedure is called as keyhole craniotomy. So this surgeons makes a small cut behind the ear. They remove the brain tumor through these incisions. So this they are going to do here behind the ear, going to do the small keyhole. Through this keyhole, how to resect the tumors. So that is the keyhole surgeries. And also coming to the supraorbital eyebrow craniotomy. So this depends upon the area is going to resect, this area is going to opening. So this that is called as the supraorbital eyebrow craniotomy. So and also next one is orbitozygomaticus craniotomy. So this one is going to be in case of aneurysms. So this type of surgical procedures they're going to use in case of the aneurysm. And also parieto-orbital craniotomy. So this is going to be the frontal, temporal, sphenoidal, parietal bones meet exactly. So here all the bones are going to meet together. So that is called a parietal craniotomy. So here they are going to that depends upon the involvement of structures and also causative factor of the bleeding or hematoma. So doctors are going to decide where they have to do the craniotomy. So if you see in the detailed manner in the craniotomy, if after planning the craniotomy, so all the planning, so assessment and also pre-assessment before the surgical procedures. So the patient is going to bring to the operation theaters, that is surgical theaters. So after lie down the patients, after fixing, so after lie down, so it's going to give the anesthesia. After anesthesia, so they have to do the 3-place, the 3-point is screwed with the screws. They're going to fix the skull in the table. So after that, so they're going to do the incision at behind the airlines. So after this fixing these positions, if they need any image guided techniques, that is stereotactic techniques, so they are going to arrange the video cameras, and also they're going to use the real a 3D computer models are going to create for the MRI scans. So they're going to put the stereotactic surgeries equipments on the patients. So it's going to automatically detect the videos. So it will help to in the surgical procedures. The system functioning as the GPS to help plan the craniotomy and locate the lesions. So these systems are going to be work with the GPS, and also instruments are detected by the cameras and displayed on the computer models. So it is going to do the surgical procedure with all the instruments. So the video cameras, and also is going to give the full information through the CT scan as well as the MRI scan. So the type of technique is called as the stereotactic craniotomy. So after stabilization of the patient on the table with the 3-pin fixations, so the incision area and scalp is prepared with the antiseptic. So after that, so antiseptic, then incisions are usually made behind the hairlines. So here is going to be the hairline. So behind the hairlines are going to do the skin incisions. So after the skin incisions, so the skin and muscles are lifted up the bone and also folded back. So after that, next the small burr holes are made and with the drill, and this burr holes allows the entrance for the special screw called as the craniotome. So it's going to hold the burr hole. So this is going to be help to the opening the dura matters. Then enter into the we are is going to check where the complications are there. So similar to using the zigzag, the surgeons cut the outline of the bone window. The cut bone flap is lifted and removed to expose the protective covering of the brain called the dura. So it's going to be after opening putting the Bur hole, so opening the dura matter. So it's a outer covering layer of the brain. So it will help to remove after opening this one, we are going to find where is the hematoma and also where is the tumor. Depends upon the causative factors, how to clear the problems through this Bur hole after opening the dura mater. So the bone flap is safely set aside and will replace at the end of the surgery. So they're going to keep this flap is aside. So after surgical procedure, they are going to fix with this into the flap is going to be replaced. But this time takes place. These surgeries are going to take 5 to 6 hours. So that's the reasons we have to keep this like a flap in another place, in the safe place. So after exposing the brain, the dura is going to be folded, and also the remaining parts are going to be like a search for any hematoma and also hemorrhage. And also the dura is opened, expose the brain. Retractors may be used to gently open the corridors between the brain and skull. So it's going to open. The surgeon used the magnifying glasses. So there's going to the magnifying glasses to identify the even minor, like a micro, like a trauma or any micro bleed or hematoma. So this is going to be also evacuate any bleed and also hematoma. So after the treatment, after the solving the problem, so I have to close the craniotomy. So this one is going to be after replacement. So after the repair, so have to replace the cranium in the proper positions, how they open. So this is going to be put back to the original positions and secured to the skulls with the titanium plates and screws. So these titanium plates and screws are going to put and also fix into the proper positions. So these plates and screws remains in the permanently to support the area. So sometimes it's going to be permanently. So if you after that, if you touch there, we are going to feel the screws and plates. So sometimes may put the drains in the window area because of if any fluid or any blood or CSF accumulated inside. So this drain will help to remove the excess amount of the fluids, so we can take out. The muscles and skins are sutured back together. A soft adhesive dressing is placed over the incision. So after that is going to get the dressing should be there. So to prevent the infections. So that is the procedures of the craniotomy. So these procedures are going to perform in case of the traumatic brain injury. So why here we have to learn in this like a surgery topics, at least we have to understand what is the basic procedures are going to perform in the surgical procedure and to manage the traumatic brain injury.